Are all movement disorders genetic? This is a fascinating question that touches on the complex nature of movement disorders. These disorders affect the nervous system and can lead to involuntary or abnormal movements. Examples include Parkinson's disease, dystonia, and tremors. While genetics do play a significant role in many of these conditions, not all movement disorders are purely genetic. Take Parkinson's disease, for instance. It does have a genetic component, with certain mutations that can increase the risk. However, most cases are influenced by a mix of factors. Environmental influences, lifestyle choices, and age also contribute significantly to the development of Parkinson's disease. Then we have hereditary spastic paraplegia, or HSP. This group of conditions is primarily genetic, resulting from mutations in various genes. HSP affects the spinal cord, leading to progressive weakness and spasticity in the legs. Another example is Charcot-Marie-Tooth disease, which is a group of inherited disorders that affect the peripheral nerves. This condition leads to muscle weakness and atrophy and is caused by mutations in genes responsible for maintaining myelin, the protective covering of nerves. Spinal muscular atrophy is another genetic condition, caused by mutations in the SMN1 gene. It impacts the nerve cells that control voluntary muscle movement, leading to weakness. McLeod syndrome is a rare X-linked genetic disorder that affects the brain, muscles, and blood cells. It is caused by mutations in the XK gene. However, not all movement disorders have a genetic basis. Environmental factors can play a significant role. For example, exposure to certain chemicals like pesticides and heavy metals has been linked to an increased risk of developing Parkinson's disease and possibly other movement disorders. Age is also a significant risk factor for many movement disorders. As people get older, the likelihood of developing conditions like Parkinson's disease increases. Lifestyle factors, including diet and physical activity, can also influence the risk and progression of these disorders. Additionally, other health conditions such as strokes or brain injuries can lead to movement disorders without any genetic involvement. In summary, while genetics are a crucial factor in many movement disorders, not all of them are genetic. Environmental influences, lifestyle choices, and other health-related factors also play significant roles. Understanding how these factors interact is vital for effectively managing and treating movement disorders. Always consult healthcare professionals for personalized medical advice regarding these complex conditions.